Hi, and welcome to this session then on health and city and places. I'm both the chair, but also on some of the information, a speaker. So what I'm going to do is just to give a sort of truncated framing before we get into the presentations from the other panelists. What we've been charged with is some questions. How can we get better at creating places that support health? How important is the built environment and other created environments to our health, and also what tools are available to help us in an understanding of the impact of good and poor urban design and planning have on health. And so what I wanted to do, just to sort of set the scene, is, in tackling this field, both the panellists and I'm sure you as an audience represent a lot of different disciplines. It's about crossing disciplines, crossing boundaries. We've got a range of speakers who've all crossed boundaries themselves, from natural environment background, myself, a public health economist, planner, and sociologists, social scientists, been involved. That's where we started from, but we've come a long way, and I'm sure what we want to do is to develop a common language, common understanding. So I wanted you just to define some terms which might be very different in the way different people in different fields and yourselves define them. And even environment, when I use environment as a planner or natural scientist, and I've come into public health, they use environment in a totally different way, a simple little word like that. So what do we mean by health, and what do we mean by built environment? And the definition of health, which is one that you've probably heard before, and I hope I'm not just sort of going round and around on the same definition, but it's really important, and I always come back to the WHO, the World Health Organization, definition of health in their constitution, 1948. Health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. And in using that definition, it's a very good starting place to then look at cities and health. And the built environment, and again, depending on what field you come from, people say, well, what about the natural environment? I think it's the built environment. We take towns and cities, whether it's parks and trees and things, someone's put them there, someone's caring for them, or someone let them be there, even if it's remnant countryside. I mean, in the UK, there is no natural environment, there's semi-natural environment. We're looking at all the environments and what we do to either preserve them or create them or change them. So very quick, not a trick question, but just hearing from you guys, I'm just calling out, random, who determines health? Who determines health? Any answers there?
I do, myself.
You determine your health. Any other? Multinational corporations. Who determines health? Social gradient determines health. Governments determine health. Any more? Health services determine, right. So even, we're coming from a lot of perspectives on here. Last one before I shut up. Who determines the built environment? Who determines our built environment? Who?
Market.
The market. Planners. Architects.
We
do. We do? We do. Do we have a say? Yeah. I mean, again, all these things are determined multiply. So to grasp this agenda, I think we need to know that and look at how the tools or the concepts that we're going to be suggesting sit in this whole domain.